Steven, what's for lunch?
Some good cold, day old Cascade pizza.
Perfect.
Hey
Yeah,
guys,
actually, 2
remember
days
when
ago, yeah.
we were having Lone Star do all our catering? I just heard that, you know, they've obviously had all the same issues that all the other restaurants had. But I heard they had also lost their furnace this past month. So I don't know if there's anything that the Rotary can do to help them, but I just thought since they had done a great job of catering our luncheons and had mentioned how much they missed them, I would pass that along.
Well, Paula, how about I put you under the announcements and you can tell the whole club that. And if anybody's so inclined to make a donation or something.
Go buy some gift certificates or something, yeah.
Something, yeah. Got you down. David Ricka, how are you?
Doing well, thanks.
Good.
Making it
Was the
work.
family?
Huh?
Yeah.
Yep. Everyone's good.
Family look good.
Yeah, we're just plugging along.
I was thinking of you the other night, David, when Cameron was singing that Cougar Fight song over and over and
Oh
over.
my gosh, that just was the best thing to see.
It's hard to tell a 7-year-old to go to bed when he's doing that.
Oh, and a Tom Tuttle from Tacoma.
Yeah, a little bit like that.
Tacoma, Washington. Yes. Oh my gosh, classic.
I think he was actually started out listening to Caps on the radio, and they must have had a game going on or something.
Brock, you're looking pretty official there in that office.
You know, I just came running in and I participated in a interview with some of the superintendent candidates, the third one just a little bit ago, caught the last end of that, and haven't even had a chance to take my coat off. So
And how's that process going? Are they slated to make a decision this week or?
you know, I believe they've been, this has really been an interesting process. I mean, they've been able to get lots of people to watch different interviews, either all via Zoom, I think. And so this week, I was able to just join in on individual ones every day at 11 o'clock for all 3 of them, but I missed this one until the very end. And so they're really getting a lot of feedback, I'm sure. And I understand that they have been having it open for a community to join in on interviews from 6 to 7 o'clock, I think, every night this week. So there's the gentleman that I just saw a little bit ago. He's on at 6 o'clock tonight. And then I believe they're going to go into session and make a decision tonight. So we'll know by tomorrow.
Okay.
My understanding anyway.
Good.
So
Good.
3 great candidates too, by the way. It's going to be a hard decision.
Yeah, I wouldn't want to be making that decision.
So I'm glad I'm not on the school board. We'll leave that up to the other ones.
Danny's not saying anything, I see. Or neither one of them.
What was that?
And
Sorry.
we'll leave that up to Danny and Eric and the others.
What was that? I didn't hear it. I was on the phone.
Oh, we were just talking about the superintendent candidates, and Brock said they 3 great candidates, and he really didn't want to be. He's glad he's not on the board and having to make that choice. So.
Thanks, Brock.
Welcome.
But thank you for your participation this week. I really appreciate you participating in the interviews with candidates. So.
But you know, y'all made it really easy just to pop up on Zoom, and everything worked like clock. So it was great.
Yeah, Kelly and Ruth deserve major kudos for all their work this week and facilitating all these meetings. So that's the one positive with how we're handling things, is that we're getting a lot more input and perspectives. So.
Yep. So well,
Great.
good luck on making a decision.
And Mike,
Yes, sir.
Two comments. One on the sponsorship. Thomas has taken over the chairmanship of the sponsor committee. He's working with Bruce to get that all hammered into shape. So in particular, if anybody has a potential sponsor or wants to name a sponsor, get that taken care of, you can talk to Tomas and he will coordinate everything and get it all set up. So that's where we are with the sponsors. And you can call me if you have any questions too, but Tomas has been real responsive. And the next thing is we don't have a theme for this year's auction. So if anybody has a great idea for a theme, Rich would like to hear it, and or you can send it to me. And anyway, we're trying to get that started up. And those are the only two auction things I have to go over right now. Besides,
Joellen and I are working on the theme right now.
Okay,
What's
great.
that, Christine?
Joellen and I are working on the theme, and we've been in contact with Gadget Publishing. So we will have save the dates out by the end of the month of March, not this month.
Okay.
Yeah, this
Well,
month
let's
you'd
go
be
ahead and
due next day or so.
Okay, well, you can see here we're.
Yeah. Hang on, Tim. We're going to go ahead and start the meeting, Tim, and then I'm going to ask you to give us a tour.
Okay.
You're on a device you can move around with, I assume?
Yes.
Okay. Well, then let's go ahead and get started. I'm going to call this meeting to order. Welcome to Sedro Woolley Rotary, the best Rotary club in the universe. Today's invocation is going to be by Chris Johnson. If you'd all please rise and bow your heads.
All right, good afternoon. I have an Irish blessing for us today. May God be with you and bless you. May you see your children's children. May you be poor in misfortunes and rich in blessings. May you know nothing but happiness from this day forward. May joy and peace surround you, contentment latch at your door, and happiness be with you now and bless you evermore. Amen.
Amen. Please join me in the flag salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Join me in the four-way test. Is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? It will be beneficial to all concerned. Go ahead and have a seat. Miss Joellen Kesty has got a, I don't know, are you singing us a song, Joellen, or are you doing a reading? What are you doing?
You know, I'll just do a reading, save you to having to listen to me sing. And it's by Barbara Vance. It's just a little reading called Your Best. If you always try your best, then you'll never have to wonder about what you could have done if you summoned all your thunder. And if your best was not as good as you hoped it would be, you could still say, I gave today all that I had in me.
Great. Thank you, Joellen. I'm looking out there and I really do not see any visitors other than the one in Carl's lap. Carl, you want to tell us who you got there?
Excellent. I would like to introduce Ellen Martin, who will be doing a presentation. Is this a good time to go over the bio, or would you like me to do that before the
when
time?
we get to the show.
Thank you. Please welcome Dr. Martin. Ellen.
And I was also speaking of the one with the furry tail that keeps waving in the face there.
That's Topaz, and I think she gained a pound since last week.
It'd be huge. Well, welcome, Ellen. I won't say Dr. Martin. Ellen, welcome. And welcome, Topaz. Okay, let's move on to club business. Rotary Foundation Weekly Moment. What is our grant model designed to do? It's meant to simplify foundation programs and processes consistent with a mission. Focus Rotarian service efforts where they will have the greatest impact by addressing priority world needs that are relevant to Rotarians. Offer program options to help achieve both global and local goals. Increase the sense of ownership at the district and club levels by transferring more decisions to the districts. And to gain greater understanding of the Rotary Foundation's work and enhance Rotary public image. The Rotary Foundation is continuing to make a difference in the world. Okay, a few announcements here. The Rotary Club of LaConner, like I announced last week, is bringing back its Smelt Run 5K race. They would love our support. It's on March 6th. It's going to be a virtual race. You can sign up via the link that I sent out last week, or you can just go out and Google LaConner Rotary Smelt Run, and it'll take you right to the link. Auction meeting next Tuesday night at 6 o'clock. A link will go out the first part of next week. Please join us. Community center. The bathrooms are, I believe, done or right on the edge of being done. We are going to also finish the doors up. And after that, I think the place is remodeled. I think we'll be completely done. And it's all because of you guys.
I can answer that. I was in the community center yesterday. It is looking fantastic. So the bathrooms are nearly complete. They're just waiting on the sinks. And once the sinks are in, we'd be good to go.
Perfect. Perfect. Patrick's Playground. Let's just switch over to Tim Howland right now. Tim, you there?
Yeah.
Why don't you give us a tour of what you guys are doing over there?
Well, right now we're watching Steve try to get something balanced on something else. So got a couple of the walkways here. And I'm hoping you don't see a big crash because it's not going as well as I hope. But anyway, these are walkways and a stairway. You can see that over here. I can't really see what you guys can see, but yep, there we go. Okay, so there's stairways. It's all kinds of stuff here set out, little packets for smaller parts of the whole thing. And these big hoops are part of the wire. What do they call that? The live wire, they call it that. The zip line, that's all that. There's a roof, other stuff. This is all quite an assembly. And then these are all connectors for it all. Here's the caboose. We just got the final parts for that this week.
Hi, Mike.
And there's Louie.
Hey, Louie.
Hi, Mike.
How are you?
John Mataran's over there. And of course, Steve Massey, who is the master of ceremonies. Dan Sims, who's the part sorter in charge. And there's Chuck. Okay.
Take a coffee break.
And here's this is going to be the train engine. It doesn't look like it right now, but there's a smokestack to attach to it and all. So that'll all come together eventually. And then of course, Mr. Tesrick has been doing some painting, staining wood, which will be for the roof of the train station, the sheltered area. Okay, and that's where we are today. We're getting a lot done and a lot to go.
Great. Well, thank you to all you guys over there working. Tim, would you ask Steve? He had originally talked at one point in time of having a small work party, maybe this Saturday, to put together some of the things that need the smaller things. Would you ask him if he still needs that to happen?
This weekend?
No.
Okay.
Nope.
Weekend.
Okay.
No work.
Not a problem. Perfect.
Signing off.
Thank you, Tim. I had a member ask me when we were going to go to in-person meetings. I guess the short answer is not anytime soon. The city is not going to open up the community center until we are in phase 3. The district governor says no in-person meetings until probably the Rotary New Year. Now that may change if a lot of vaccines get done, but at this point in time, the district is saying no in-person meetings. Now, I don't know, that's probably not what most people wanted to hear. Carl, I know you went to a meeting last night, or it was last night or Tuesday night, that was kind of a hybrid model. How did that go?
Well, I haven't been to it yet, but I'll be going early next month. And
Okay, let me know how that goes. Yeah, but right now what we're hearing from the district level is they're saying no in-person meetings until probably the Rotary New Year. We'll see if that holds up. Paula, Katie, I can't even talk. Paula.
I'm here. Yes, I had mentioned that, oh my gosh, I've forgotten what I mentioned.
Lone Star Barbecue.
Thank you. Yes, all of us who had the pleasure of being fed by the Lone Star restaurant during, before COVID hit, just want you to know how much one time when I was in their restaurant a little bit ago with Jason Miller, the mayor there, that they mentioned how much they had enjoyed doing the luncheons for the Rotary and how they hoped they could do them again soon and all of that. And then I just heard that they have lost their furnace there after all the other things that our restaurants have gone through this past year. So I was just encouraging people to go up there, to buy some gift cards, to think of other ways to help support them. I think it's important that we do that. Can I do one more real quick one? Pam Carpenter at the end of Metcalf with Pam's Pastime Antiques lost her husband Rusty to COVID this past weekend. So support for her would be appreciated as well.
And for those of you that don't know Rusty Carpenter, he was pretty much one of the founding fathers of the EMS system in Skagit County. He was one of the original paramedics, if not the original paramedic. He had a hand in training most of the paramedics that are working there today, including my brother and a couple of guys I play golf with. It was a complete shock. He was a wonderful man, and he'll be sorely missed. So, yeah, if you know Pam, if you know the family, reach out to him by all means. Okay, the other thing I wanted to talk about just briefly are community projects. Now, our big focus this year has obviously been Patrick's Playground and completing the community center. After talking to Mr. Huggins, there may be a few dollars left after we get done here that we could possibly do some other things. What I'm asking all of you is to think about things that we could do that maybe don't take a lot of money, things that might be something we could have small groups go out and do, whether it's, I don't know, painting park benches or cleaning something up, looking for ideas there. If you have anything, if you know of anything, get it back to me so I can get it to the board and we can talk about it. We're always looking for things to do. So if you got something out there, let us know. And with that, I have no other announcements. Is there anything else anybody wants to bring up here? Well, I don't see anybody raising their hand or willing to speak, so we will move on to Happy Bucks. Who's happy?
Actually, I have something really quick, if I may.
Mr. McCann.
Yeah, I'm just putting the finishing touches on our goals for the year, so I'm going to get those to you, and then I'd like to have everyone kind of take a look at it and see what they can do to help us fulfill our goals. So I was hoping to have them done before today's meeting, but life caught up with me again, so I will get them before get them hopefully today or tomorrow to you, so everyone can, maybe we can find a way for everyone to take a look at them before the next meeting.
Okay, just a little background on that. Rotary presidents are required to set goals for the Rotary Citation Award. This club has been fortunate enough to receive the Rotary Citation Award a couple of times. It's not something we get every year. I have no great expectation that we're going to get one in this weird year, but Jeff offered to take this on and do all the hard work. We're required this year to choose 13 goals out of a possible, I think it was 25. So Jeff is putting that all together. When he gets it to me, I will get it all out to you. You can give us your feedback on it, see where we're at, and we'll go from there. So that's what that's all about. Okay, now who's happy? I'm happy because I'm leaving for Reno on Saturday. We're going to try it again. You know, we were supposed to have gone 2 weeks ago and got all our flights canceled, so we didn't get to go. But Saturday I get to see my granddaughter, so that will be wonderful. So I'm going to throw some happy bucks in. Who else?
We're happy because 12 happy dollars. River turns 12 months on Saturday. We're going to the zoo.
How did that year go by so fast?
I know.
Wow. Wow. Happy birthday, River. Who else?
I'll throw in a happy 20 because I've been watching all of the superintendent search Zooms, and Mark Ben's group has done an incredible job. And I will be happy with any of the 3 candidates that they've selected. I'm just so impressed with them, and we're very, very lucky to have that type of quality able to represent us here in Sedro Woolley. We're very blessed.
Thank you, Ruth. And I think we all should give happy bucks for Ruth and all the hard work she's been doing. She's putting a lot of hours in with the school district right now. Anybody else happy? Well, if not, I'm going to let Mr. Carl introduce our speaker today. Carl?
Thank you, President. I'd like to introduce Dr. Ellen Martin, goes by Ellen, and she is a graduate from New York University, did a residency in family medicine at the Cleveland Metropolitan General Hospital, Case Western University. She owned and managed Tumwater Family Practice Clinic for 17 years, and she's practiced primary care, obstetrics, hospital, geriatric, and hospice medicine for over a span of 33 years. For the last 6 years, she has worked at Harvard Clinic as a walk-in. And please welcome Ellen as she brings forth the presentation, Medical Insurance from its Inception to its Future, What the Consumer Needs to Know. Ms. Ellen.
Carl neglected to mention I'm also his happy bride of 2 months. And a new resident for the past 6 months of Sedro Woolley. Happy to meet you guys and to be here. The only other thing I want to share is, although through this last 33 years, I've learned all the things that I'm going to share, the most I've learned is from the fact that I am the daughter of primary care doctor whose office was attached to our home, who I grew up pulling charts for and rooming patients. I am the sister of an ICU nurse, a neonatal ICU nurse. I am the other sister of a pharmacist. And I have gone from going on house calls with my father to owning my own practice, to working for a federally funded healthcare center, and then working in a large 24-hour urgent care in Las Vegas, to working for the Everett Clinic. So I kind of have seen it all. And it's from this experience I share with you, not from any knowledge of insurance companies from the inside, rather just like you from the outside and what we've had to learn and endure. So take everything I say with a grain of salt, but I've lived through it. So I'd like to share my slides now if I can. Let's see. I don't know where they'd come up.
Okay, are you sharing them on your end or do you need me to
No,
share
I
them?
need you to share them.
Okay.
Yeah, would you mind sharing for him because she's not the host here?
Okay, let me see if I can do this. I know there's a share screen. Share the screen. Share that one, maybe.
I don't see him.
Well, I'm still trying to get there.
I think
Getting
you
close.
found it.
Yeah, I just,
And I think you want the untitled there.
well, let me get down here. Okay, let's see if this works.
There it is. I'm
Perfect.
impressed.
Okay.
Perfect.
So now I need the button that says start, I'll move a window here.
Okay.
Start slideshow. There we go.
Okay.
How we doing?
Perfect. Okay, go to the next slide, pretty please.
Okay.
Okay. So I researched this, although I had known some of it before. In 1900, when all of us were hopefully a glint in someone's eye, people paid for their health care out of pocket. There was no such thing as health insurance. Healthcare costs were in the 50 cents to $1 range. People went to hospitals to basically die. Healthcare was pretty simple. But after and during World War II, medical developments started to happen. Surgeries became a little bit more frequent. People actually went to hospitals for care. And in Texas, an organization called Blue Cross, a nonprofit organization called Blue Cross, set up ways for people to get their hospital costs paid for, which was pretty unusual for the time. In California, Blue Shield, also nonprofit at that time, did the same thing for doctor visits. So things were starting to perk up. Costs of care were starting to increase. So these nonprofit organizations help people by putting money aside to pay for potential hospital bills. We now move forward to 1935 when, after the crash and lots of people were in dire straits, FDR set up Social Security. And he deemed it a safety net for poor people. Interestingly enough, there was no health insurance associated with Social Security when it was first developed. It was simply a way to survive. And so at that time, it was just a payment monthly in order to cover your living expenses for the very poor and indigent. So we now move into World War II when the country needs a workforce. Because of all the limitations and need for workers, limitations on salaries. The government said how much they would pay, how much you could pay your workers, and the large companies were trying to get people to work for them. So what they started to do was say, we will pay for insurance for your healthcare costs if you will come be an employee. And that is how healthcare began to grow in the United States. Large corporations, munitions, fabric, shoe suppliers developed health insurance for their employees. And so between 1940 and 1960, we went from approximately 20 million people insured at the beginning of this program to 142 million insured over the next 20 years. And primary way to get health insurance then, as it is now, is through the company that you worked for. And we are the only nation in the world that is health care insurance is driven by employment. Everywhere else, it's either state or self-pay. But because of what happened during World War II, we became employment insurance driven. So now we move on, and because by 1960, it became clear that some people were unemployed, and when you became retired and you didn't have insurance, there was a large gap in the insured. And so President Johnson created the two entities that we know as Medicare and Medicaid. And for the longest time, even as a middle-aged doctor, I couldn't remember or tell the difference. Medicare is for the elderly and the disabled. So you have to be older than 65 or completely disabled. And Medicaid, which we'll learn, is for the indigent and the underserved poor. So as we move on, few people are really aware that in the 1970s, President Nixon was the first president to bring up the idea that maybe we should have universal health care. And he actually worked quite hard with Ted Kennedy and tried to get universal health care for the United States, but was unable to do so because of politics and because of the requirements, and fell quite short. Then again, more people will remember this. Hillary Clinton spent a lot of time in her husband's first term trying to develop a universal health care bill that would sell to the American people, and fell quite short again because of the costs it entailed, who would be covered, the ultimate questions of who gets what. Then we move on to close to where we are now, and to the Affordable Care Act, or what is fondly known as Obamacare. And that is when, in 2008, it was passed with the goal of increasing the amount of health care available. And most of us know about this. We'll talk a little bit more about it. Lately, it's later in the talk, it's pretty controversial, and many changes have been made by the Congress, by the Supreme Court. But really, we're stuck in this little time frame of where we're sort of in Obamacare still, but lots of changes have been made. Next slide, please. Okay, so we call who pays the bills the payer market. You know, who is funding what we're doing for the patient. And these are the main people in the payer market today. Private insurance, Medicare for the elderly and the disabled, Medicaid for the indigent and for children, TRICARE for active military not in a war zone, and for veterans, the federally funded health care plan, which is the golden plan, which most of our Congress people and the president and people in Washington have, very well-paid plan. Then there's workman's compensation. We call it L&I in Washington. It's a very limited plan. It's only for people who get hurt on the job, not for people who suffer other things on the job. It's got its difficulties, let's put it that way. And then there's Indian Health Service, which is completely outside of this, run as the tribes are separate by the tribes, but funded by the federal government, and is very wide open. A person who has Indian Health Service can be seen 3 different times in 3 different places in the same day, and it's all covered, believe it or not. Next slide. Okay, so who are the private insurers? We know a lot of them by name: Cigna, Humana, United Healthcare is a big player. And I will talk to you now quickly about, so I work for the Everett Clinic, which means, truthfully, I work for United Healthcare. In 2018, the Everett Clinic was bought out by a company called Optum, which is a division of United Healthcare. Well, how does that work? Well, United Healthcare is smart enough to have made a division in their company where they have an insurance side and a medical service side. And if you watch United Healthcare stock, it has gone through the roof over the past 20 years, and it has been based on the healthcare side. They are going around the country, buying up organizations, the Polyclinic, the Everett Clinic, And they're sort of in a kind of a little ongoing, not war, but who gets what. Kaiser is another player in this thing. We're going to get to a point where we're going to get to what I call corporate medicine, where everybody owns everybody else, but we'll talk about that later on as well. Other ones, other smaller plans, Primera, which is very, known around here, Regents, which is, and you see how those Blue Cross and Blue Shields are no longer nonprofit. They didn't survive very long, maybe about 20 years as nonprofits. So, but all of these companies are employer negotiated, employer funded to some degree. Now, a lot of people pay portions of their health care out of their salaries. Up until the 1990s, the employer paid the health care completely. Unions negotiated that so that the employees didn't have to pay, but pretty much now everybody pays some of their own health care. The problem is different people negotiate different ways, and just saying I have good insurance, I have Humana, doesn't go. Humana in one condition may pay for everything, and in other conditions may have a huge deductible, not pay for any medicines, and you can't just go by what the insurer is. You have to go by the plan, by the group within the plan, and by what was negotiated. And I know a lot of you have seen when you quote unquote sign up for insurance, you have 4 choices in what you sign up, and you pay differing amounts. So even within the same company, you can have different insurance than the guy sitting next to you. And that is not it's not easy. Because it's hard for you to know, for example, what medication your part of the plan will pay for, how much of the visit you're responsible for, and which doctor group you can see. But, that's where we are today. It's very, very specific. We'll talk about pre-existing conditions when we get to Obamacare, but next slide. Okay, Medicare. It used to be so easy. It used to be, I have Medicare. Medicare pays 80% of the bill. I can go to any doctor I want to. All I do is pay my 80%. Well, not so much anymore. Medicare is paid by the federal government, and it loses money every single year. And every single year, there are cutbacks to Medicare. So you may not be getting what you got last year. Interestingly enough, when Medicare was formed, it was only meant to cover 60% of a person's healthcare costs. And it was only meant to cover people over 65 and people with severe medical illnesses like renal failure or on dialysis. And because of that, it doesn't cover a lot of things. It does not cover nursing home at all. It does not cover wellness visits at all. It does not cover many medications, including types of chemotherapy, what Medicare deems as experimental. It doesn't cover a lot of things. The first thing that was negotiated with Medicare was, oh, well, I need an insurance to cover what Medicare won't pay. So our friends, the insurance industry, developed what's called gap insurance or Medigap. Well, interestingly enough, now probably 75 to 80% of people on Medicare have gap insurance. And yet gap insurance only pays that 20% that Medicare didn't pay. It will not pay anything that Medicare didn't cover. So gap insurance doesn't cover you for the nursing home. It doesn't cover you for the medicines that Medicare denied. All it does is cover that 20%, which leaves yet another gap for you to pay. So in 1997, somebody had this brilliant idea of offering what we call patient lives to these large insurers because they always felt that they could do a better job than the federal government. And that's how Medicare Advantage programs came along. These are the programs they try to sell on TV. We will pay for your gym membership. We will pay for your transportation to visits. we will get you more things than plain Medicare can. Well, these plans cost you, the patient, 12% more than straight Medicare. And yeah, they do offer some eye care benefits, more wellness benefits, gym memberships, but you are limited. You have to see the doctors in that specific plan. You have to use the medications covered by that specific plan. And what their goal is to entice and get healthy elderly people to bring down their costs. So if you're a high utilizer or you need a doctor, a specific doctor to help you out and they're not on their plan, you're out of luck. So you have to be really careful when you sign up. You have to go through all these Medicare Advantage programs, see which ones will cover your medications, your providers, and if it's going to work for you or not. So, and at present, 40% of Medicare people over 65 choose to do Medicare Advantage. So, next slide. And then there's Medicaid. The problem with Medicaid is it's mandated by the federal government and funded by the state. Doesn't work when you're getting bossed around. And so coverage and eligibility really vary from state to state. I know that when I was living in Nevada, people would leave Nevada and go to California because it's easier to get Medicaid rather, sorry, in California. It was originally only made for the destitute. But again, in 1997, the federal government mandated to the states that low-income children and pregnant women needed to be covered. That's the Children's Health Insurance Program. And so the federal government threw in about 25 to 30% of the costs so that it would occur, but the states are financially responsible for it. So this works out fairly well for children and for pregnant women, not so well for the indigent poor, because you have to be really poor to qualify for Medicaid. And so right now, the primary people who are covered on Medicaid are children and pregnant women. Next slide. So then there's all the other, again, TRICARE. TRICARE is solely covered by being active duty or veterans. It's a difficult thing because they get a much better deal when they go to the VA, but if they can't get into the VA in a timely manner, they come, and some people accept TRICARE, some people don't. It's better than nothing, but it's not great. And again, federal employees have the best health benefits of any of us. Workman's compensation has its issues. If you are being bullied at work and suffer a quote nervous breakdown, it's not covered by workman's comp because that was your problem. If you are stressed, don't get any sleep and have a heart attack, you're going to have to fight with workman's comp to get it paid for because that was an injury. It was not an injury. It was an illness that you had and was dependent upon you and not upon your job stress. And so there's a lot of difficulty there. Of this environment, we come up with high deductible, inexpensive plans. You can have a $10,000 deductible, and it's a really cost-effective plan. The problem is I don't know many people who have $10,000 laying around to pay for out-of-pocket costs before they get any health insurance. And so, and they don't figure this out until the big problem comes, and they're really kind of stuck thinking they have some good insurance or reasonable insurance, and then they can't use it. The other thing that's recently developed are what we call health savings plans, very popular with millennials who are never going to get sick, who are never going to use their health insurance. They put money away into an account that's tax-free and let it sit there for years until they need it for health insurance costs. This has only been available for the last 4 to 5 years. Again, it works for a healthy person. It doesn't necessarily work because of the cost of medical care for those of us who couldn't put enough away for a single $200,000 hospitalizations. So, next slide. So the costs keep rising. An average emergency room visit for an ear infection costs $1,000. An average hospitalization for an appendectomy costs $150,000. Who's going to pay for all this? And if you're uninsured and you show up, we don't turn you away, you know? Who is paying for all this? So I think we have problems ahead of us. Next slide. Okay, let's talk about Obamacare. The original goals of Obamacare were good. They wanted to make insurance more affordable. They wanted to increase the number of people in the United States covered by health insurance. And they wanted to support preventive and primary care that would attempt to lower medical costs. Next slide. How are they going to achieve this? Well, they said they're going to attempt to get more people insured by spreading the risk. If we have more people who don't use their insurance, we can cover the people who do use their insurance. That was the idea. So what they said was every employer needed to provide insurance to all their employees. Now, they did make amends for the fact that very small employers couldn't afford it. So there were some loopholes, but still, this was not it was a mandate, and it didn't work out so well. They set up marketplaces where states could monitor our friends, the insurers, and coordinate so that insurance plans were cost effective and good for the members. And those marketplaces still exist. Washington still has an insurance marketplace. They did away with pre-existing conditions. Everybody knows this, because before, if you lost your job and you had a pre-existing condition, there was a good chance you couldn't get insurance again because you were too high risk. So they did away with that. And now everybody feels good about that. The other thing they did was they allowed, and this is still in effect, parents to keep their adult children up to the age of 26, even if those children are married, even if those children don't live at home, on their current health insurance policy. And then the final thing they did, which was a little difficult, this should say it expanded Medicaid, dumping the cost on the states to cover the more people that needed to be insured. And that was a little bit of a difficulty. Next slide. So what are the pros of this? Well, the basic outline of the Affordable Care Act is still in place today. There's a lot of things went away. The mandate to insure was really played upon, and a lot of employers would rather pay a small fine than insure the cost of insuring their employees. The mandate to get insurance, no matter whether you're healthy or not, people ignore it, and there's been no way to enforce it. So there have been changes, but 20 million more Americans now have insurance than they did before the act was enacted. And according to this institute, if the Affordable Care Act was repealed, 82% of those losing insurance now would be adults who lack a college degree. 56% would be non-Hispanic between the ages of 18 and 34. So more people are now insured than they were before. In addition to increasing insurance coverage, they have tried very hard to reduce costs and improve the quality of health care. That has been a little bit more difficult. But as of September of 2020, 52% of Americans approve of the changes and believe it's a good thing. You know, of course, of those 52%, 94% of them are Democrats and only 6% are Republicans. So it's become very political. Next slide. Again, the cons, they can't mandate for people to get insurance. People ignore. The subsidies from the federal governments are now coming from other sources like Medicare. Medicare decreases services and Medicaid increases. That's been hard for people to swallow. And insurance premiums have gotten higher and higher and higher because the people who get this less expensive marketplace insurance use it. And so medical costs rise, and so insurance premiums rise, and, you know, it's difficult. And finally, we don't have enough doctors. So give people insurance, but don't have doctors to use that insurance, then we're not doing anybody any favors. Next slide. So, you know, we sit at a place where we don't know where we go from here. Everybody has an idea, nobody has a solution. Universal coverage administered by the federal government, who admitted that they can't can do a good job at it, administered by the insurance companies, who are the highest increasing dividends and profits of companies besides the tech industry. And who's going to pay for it? And who's going to decide who gets what? We don't have answers to any of those questions. Administered by big corporations like Amazon, like United Healthcare, who run the industry like it is a corporation, where your doctor becomes a cog in the wheel and doesn't discuss things with you because it's told not to by the corporation? Or do we stay where we are now and see what happens? Of note, because of COVID, because of all that's gone on, 8% of current primary care doctors intend to retire within the next 6 months. Actually, 8%, sorry, have retired so far. They expect another 8% because people aren't going to the doctor anymore. Even at the walk-in clinic where I work, we're 40% down on people coming in for urgent care because they don't feel safe. And there's going to be difficulty in the future in finding your primary care doctor and keeping your primary care doctor, and nobody knows how it's going to end up. So we're in a challenging situation. When somebody gets sick, when anybody gets sick, they expect and need care. And the care that they've been getting over the past year has been expensive care. And yet we don't know how we're going to pay for it. So I don't leave you with a bleak situation. I leave you with a changing situation. The profession I entered is not the profession I'm working in. So many things have changed, and not all for the good. But that's where we are today. So that's my 2 cents.
Well, have you got time for a few questions, Ellen?
Yeah, sure.
Maybe I got some questions out there.
Oh, Teak Martin here, retired internist from Sedro Woolley. Yeah, incredible presentation, Alan, just summarizing everything that's happened in medical practice over the years, and you and I can be happy we're retiring now.
Soon, I got a little ways to go.
Just a couple comments. It's when I first started in the 70s, we had Skagit County Medical Bureau. And when I started, I think it was like $40 insurance cost per month for me. And the doctors got maybe 50% of that, and the pharmacy 10 or 20%, and the hospital 30%. But what we've come to expect in care and what we can get and how quick we get it has generated these huge hospital empires. And even to the point now that the insurance companies are so big that they're buying the major clinics like your clinic in Everett. and major hospital chains. So it's just big business now. You know, it's almost like the government versus the hospital empires versus the insurance empires versus the pharmaceutical companies.
And where does the
And-
patient fall there?
Right, and who pays for it all? And one thing the American people don't realize when we compare our costs to, say, Canada, then the Canadians wait tremendous periods of time for any elective coverage, and maybe they'll die or get well before they need to have anything done. So we're getting the Cadillac of services in the US. And things are going to change, just like you say on primary care, less and less primary care providers. Well, you know, you're likely to go in and see the nurse practitioner, the physician's assistant. The level of care on getting into the system doesn't have the training that it used to have. So it's already starting to change. And the big thing in my mind is, yeah, it would be great to have some sort of federal coordination and something like that. But the plan I don't think you mentioned was the Veterans Administration. It's like, okay, let's look at how things are at the VA. That's a big government administered run plan. And that's what you get with the government running things on the bureaucracy. So we may complain about the insurance companies and the hospitals and all. And in my mind, some of the people that are really in trouble is if you look at your hospital bills now, you know, if it's a $1,000, probably a $2,000 ER visit, well, you know, let's take 50% off to start on what Medicare or the insurance company allows, then they pay $200 or $300 on the $2,000. So all these costs, if you don't have some government entity or plan negotiating with the hospitals, well, they're billing you for $2,000 and your insurance are $200 or $300, and let's hope that they have a firm agreement with the hospital that you end up paying $100 instead of the extra $1,500. It's kind of a nightmare of where these charges have gone. But I just want to congratulate you for doing such a great coverage on what's happened over the years and explaining that so well. And you and I can be grateful that we're retirement age now. And thanks for doing the talk.
Other questions, please speak up. Well, the one comment I have, Ellen, is, you know, my wife and I, and we still got one daughter on the insurance plan, you know, we've always had a high deductible HSA plan, and the costs have just, you know, exponentially increased every year. And for this year, for the first time, they actually went down a little bit. And I was curious, do you think that's something that's going to continue to happen, or next year they're going to go back up, or it's a crystal ball kind of question?
No, I think that's the cream of the crop now. That is the plan they like to sell. It is good for the insurance company because you feel confident that you're not going to use it.
Mm-hmm.
And so they like you. So I think that you will be courted and your prices will go down. The problem occurs is one bad year is okay, but 2 bad years and you may have difficulty.
Yeah.
So.
Yeah, it's always been this juggling act, trying to, you know, God, we never use our insurance. Do we even? Well, yeah, we need it. I may break my leg, and then we're bankrupt. And
right.
You know, so you buckle down and you pay it. But
and most wise people, like I say, can live one bad year if you put in your HSA and you take care of yourself. But the problem, it's a gamble.
Oh, it is.
You know what? I don't disagree with that. With your car insurance, you're gambling. You know, my car insurance is going to cover it. People don't view health coverage as insurance. They view it as, I have this, so I can use it. Why not go in? I pay my insurance. You don't view your car insurance that way.
Well, yeah, I guess we don't want to just run into things for the heck of it. But oh, and then back to Teek's point about, the bills in hospitals. I mean, my wife had some lab work done, and the charges came in. The EOB said there was like 900 and some odd dollars worth of charges submitted, and they paid $91.
Right.
It was like, why the discrepancy? I mean,
Because
why?
your insurance company negotiated for that price. And if they can get 600 from somebody else, they'll make more money.
See, and in my mind, that's part of the problem. It
is.
should be X costs this and Y costs that, and it doesn't matter who you are, that's what it costs.
Nope. So
Wow.
this is tales beyond the beyond. So when I started with the Everett Clinic, there was a CEO named Rick Cooper who was very interested in showing costs. He's an older guy, and he retired before the sale to DaVita and then to the, and guess what? We're not showing what it costs to get things anymore. The corporations don't want you to know.
Yeah.
Well, the hospitals don't want you to know either.
Right, correct.
And the federal government for the last year has been trying to get the cost of a gallbladder done in Everett versus Seattle and the different hospitals, and the hospitals won't give it, and the federal government even can't get those prices from the provider systems, i.e. hospital chains.
Yeah, we have problems before we have solutions.
Yeah. Anybody else have a question before we close this up?
Well, interestingly enough, I've dealt with a lot of medical costs this past year. And one of the things that I just would like to comment is I have been thrilled that I am on Medicare, because I've looked at these statements of what is being paid. And this summer I had a treatment for the liver cancer where the treatment, not the doctors, not the facility, just the actual treatment was $99,000. And it didn't cost me anything. So I was very happy with that.
But see, the nice thing about Medicare also is probably you've paid Medicare premiums since 1964, whenever Medicare started, and that we've been paying things. When Obamacare started, it was interesting. I had patients who say had been self-employed for all their adult lives and signed up for Obamacare and came in and instantaneously got $100,000 of curative medicine for their hepatitis C and all these surgeries they've been deferring, and they hadn't paid a penny into the healthcare system for the last 30 years before that.
Well, Ellen, thank you for taking the time to present this program. Very, very interesting.
Most welcome.
And congratulations to you and Carl on your new babies there at the house. They're cute as all get out. Well, is there anything else that needs to be brought forward today? Speak now or forever hold your peace. Well, I normally leave you with the thought of the day, and lately they've been kind of serious or, thought-provoking or whatever you want to say. But today I actually have kind of a lighthearted story. A 6-year-old and a 4-year-old are out raking the yard. The 6-year-old asks, you know what? I think it's about time we start learning how to cuss. The 4-year-old nods his head in approval. The 6-year-old continues, when we go in for breakfast, I'm going to say something with the word hell in it, and you're going to say something with the word ass. The 4-year-old agrees with enthusiasm. When the mother walks into the kitchen and asks the 6-year-old what he wants for breakfast, he replies, hell, Mom, I guess I'll have some Cheerios. Whack! Flies out of his chair, tumbles across the kitchen floor, gets up and runs upstairs crying his eyes out with his mother in hot pursuit, slapping his rear with every step. His mom locks him in his room and shouts, you can stay there until I let you out. She then comes back downstairs, looks at the 4-year-old and asks with a stern voice, and what do you want for breakfast, young man? I don't know, he blubbers, but you can bet your fat ass it won't be Cheerios. With that, I say goodbye.
Oh.
Have a great week, and we will talk to you guys later. Bye.